Welcome to Be Wise, information about cannabis for older adults. Brought to you by Active Aging Canada, a national charity that supports older adults living well and remaining active. Production for this podcast was made possible through a financial contribution from Health Canada's Substance Use and Addictions Program. Now, let's go to the Active Aging Canada studios and join National Executive Director Patty Clark and Ward Maxwell, Director of Marketing and Communications. Today, how cannabis can help with pain and arthritis.
So today we are talking about medical conditions in cannabis, but we want to specifically speak to certain kinds of pain and arthritis. So often cannabis is promoted as a universal option for pain relief, but the current research only shows positive results for nerve pain as it relates to certain conditions. And I'm emphasizing it's the current research now. There's a lot of discussion going out there, but there's not a lot of evidence yet to support a lot of other theories. So right now, the research does support cannabis as it relates to multiple sclerosis and diabetes conditions, pain related to HIV, post-surgical or post-traumatic pain, or fibromyalgia. So the neuropathic pain is associated with nerve damage. And it includes like a shooting or a burning pain, as well as tingling and numbness. And it can be severe and it can come in waves. So this type of pain is common with diabetics, nerve or spinal cord compression, and chemotherapy. Now, the cannabis-based medicines have showed moderate neuropathic pain reduction. And I'm emphasizing again here, moderate pain reduction, because the effectiveness varied according to the source of the pain, the length of the treatment, and the type of cannabis that was used. There's an organization called the Canadian Pain Society, and they are a professional body, and the Canadian Pain Society currently recommends cannabinoids as a third-line agent. And that means that they are suggesting to try it only if other treatments do not work.
We're also going to talk about arthritis and treating arthritis pain with cannabis products. Just to remind you, arthritis or osteoarthritis is common among older adults. The pain is thought to be caused by damage to the joint, inflammation, or nerve damage. I understand about this because I actually have early onset arthritis in my left knee, and I'll tell you it's not much fun. I'm having it treated at the moment using physiotherapy, acupuncture, and a brace. But if it comes to the point where I need pain management, then I'm going to be honest with you. I'm going to consider a cannabis product first before I use opioids. Here's what the research says cannabis can do for arthritis. There are endocannabinoid receptors in joints, and cannabis has anti-inflammatory properties. The theory is maybe cannabis can reduce the nerve pain from the osteoarthritis. The research studies in animals are showing promising results, but there are no studies in humans yet. So remember, we're trying to present you information that is based in research. Well, at the moment, this is a mixture of research and anecdote. The story is very much the same with rheumatoid arthritis. There's very little research, but early study has shown promise. And it's also shown that a mouth spray called Sativex can reduce pain related to rheumatoid arthritis. Here's the important point. Both the Arthritis Society of Canada and the Canadian Rheumatology Association understand the interest in cannabis, and they are suggesting take a practical approach. The same thing we're telling you. If you're interested, you must take part in your treatment. You must take a low dosage at the start, assess the effects, and become part of the process of your treatment. Well, that's all we're going to do for today on pain, and next week we're going to follow up with cannabis products use in palliative care and also treating sleep and insomnia. Thanks for listening. Thanks, Patty.
Thanks again, Ward. Talk to you next week.
Well, that's all the time we have for today. For more information, go to activeagingcanada.ca, where you can order a copy of our Be Wise booklet. It's available in 17 languages and is free. The views expressed in this podcast do not necessarily represent the views of Health Canada's Substance Use and Addictions Program. Join us for our next podcast. And until then, remember to be active, be healthy, and be wise.